You also have a document in Blackboard that is healthy eating guidelines or carb counting. And what it is a listing of the different food groups that we just talked about that have carbohydrates in it, the type of food, the portion size, and then how many carbohydrate choices would go along with that. So for example, here on this sample menu, breakfast of 4 carbohydrate choices, that might be 1 cup of oatmeal, which is 2 carbohydrate choices, and a banana, which is 2 carbohydrate choices, and then a cup of coffee, which doesn't have any carbohydrates, and maybe a hard-boiled egg, which is no carbohydrates. Okay, so our 4 carbohydrate choices, individuals can utilize those however they would want. If they want a really large portion of oatmeal, then they wouldn't have any carbohydrates left for a fruit or a milk or a vegetable. So our next slide then talks about exercise. It is essential to therapy. That's going to allow that blood sugar to get into the cells for energy. So remember, one of the hallmarks of type 2 diabetes is that insulin resistance. So our cells are making insulin, but our beta cells in the pancreas are making insulin, but our cells do not want to accept it for energy. So we're just cruising around with really high blood sugars because none of that sugar is getting into the cells, and our cells need that for energy. So there was a very brief review on diabetes. Don't worry, we'll continue to work with this. And then as you flow through the program in medical nutrition therapy 1 and 2, we'll get much more involved with diabetes. Pre-diabetes, type 1 diabetes, type 2 diabetes, and gestational diabetes. I want you to be familiar with the different types and what's happening physiologically with those types of diabetes. Our last 2 slides in Chapter 6 deal with cancer and HIV/AIDS. So we're looking at, for cancer, a term called cancer cachexia. And remember when we talked about CHF, congestive heart failure, we talked about that term cardiac cachexia, which is the wasting away of that heart muscle and really causing some problems nutritionally for that individuals. Cancer cachexia, it's CACHEXIA. It's malnutrition caused by cancer or the cancer treatment. So something like radiation therapy or chemotherapy, especially if delivered in the head and neck region or in the GI tract, that can cause problems swallowing, chewing, mouth sores, diarrhea, nausea, vomiting. So it's not just the cancer that can cause us malnutrition. Oftentimes it's the treatment. Some terms that we want to know when we're looking at cancer: a malignant tumor, that means that it's a cancerous tumor. A benign tumor means that someone has tumors, but they aren't cancerous. So this is the better scenario. And then the worst case scenario would be this called metastasis, or oftentimes you'll see it abbreviated as METS. So it's an uncontrolled growth throughout the body. So in our medical terminology, when we're looking at the medical chart, we might see a diagnosis of breast cancer with METS to liver. What that means is the cancer originated in the breast and then grew uncontrollably into the liver. It's not a good sign when we see that metastases. You'll see in this point here that good baseline nutrition is so important prior to treatment. But again, this is difficult because oftentimes these folks have been sick for a while before they were diagnosed with cancer. Pages 160 to 162 have a very nice, thorough approach to the treatment of and nutritional recommendations for those that are going through cancer and then the treatments associated with it. So make sure that you look at that for review for your exam. They may be prescribed what's called a neutropenic diet, and this would be for our HIV/AIDS patients as well. A neutropenic diet is a diet that is very low in its risk of spreading any sort of pathogen that